My name is Dr. Brian Szabo. I am a cataract, refractive, and glaucoma surgeon at NewSemi. I've been working with the SBL lens, or the ClearView3 lens, for about 1.5 years now. So the craziest thing is when using the ClearView3 lens in terms of outcomes, the patients know exactly, like they can literally have the surgery and then 10 minutes later they go to the post-op kind of area and they can read their watch almost within 10 or 15 minutes. And that's because of that great add power that the ClearView3 lens gives you in terms of the reading portion. Patients immediately are just like, oh my God, wow, there it is, kind of thing. And obviously there's some healing and some things that go on next couple of days, but instantly, at least in my experience, there is a reading component that pops for that patient right away. A lot of the times we try to simulate for a patient what their vision would look like after surgery. So we go into asking questions like, hey, what do you like doing on your daily routine? What are some of your hobbies, some of your likes, your dislikes? Are you active? What do you do sport-wise? And we kind of frame it as, what has the patient already had with their vision? Have they used multifocal contact lenses? Have they used progressive transition lenses in their glasses? And when we ask those questions, we get kind of a feel of what a patient's used to. So if a patient's more used to a multifocal contact with rings and different concentric portions of the lens, we kind of lead them down a multifocal ring lens. If patients love their progressive lenses, they love a distance to near transition, we kind of lead them down into more of the ClearView3 lens where you have that progression. You kind of want to keep a patient on the same page that they've always been on. You want to keep them comfortable, you want to keep them using the same technology that they've been using their entire life. So we say with any kind of lens we use, whether it's a ClearView3 lens, whether it's any other kind of multifocal lens, or even a monofocal lens, these lenses are built to last. So we always tell patients, you only get one cataract surgery. This lens is going to last you for about 100 years. So we always kind of joke with them and say, we'll be digging these up long after we're gone, okay? Because they do last forever, and it's your one chance to kind of get some kind of technology in your vision that gives you some distance and gives you some reading vision. The biggest thing is the patient selection, just with any other type of lens, okay? So with this lens, they don't make it in toric powers because it's not a symmetric optic. So you need to pick a patient with low astigmatism, okay? Usually we pick anybody from like 0 to 1.0 diopters in terms of astigmatism. Also, you want to make sure the patient has a large pupil. Not large pupil, but they can't have a pupil less than 3.0 millimeters in photopic positions, okay? So 3.0 millimeters or less, we kind of stay away from the ClearView technology. And we can go more so with a different type of multifocal technology. So those are the two things I would tell younger surgeons or surgeons who are just starting to use this technology. Look for patients with low astigmatism. Look for patients that have a above average size pupil in normal light conditions.